Medical practitioners too. Letter A, hospital staff. The people who work in any type of workplace, including hospitals, are called staff. The medical staff is a British hospital belong to one of four main groups. A pre-registration house officer, PRHO, or house officer is a newly graduated doctor in the first year of postgraduate training. After a year, he or they becomes or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Dr. FJ1, C Unit 12. A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year to Doctors FJ2, but the old term Senior House Officer and SHO are still used. A specialist register, SPRR, is a doctor who has completed the foundation program and is training. Is one of the is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists. Senior doctors who do not wish to become consultants. In addition, there is at last a medical or clinical director who is responsible for all of the medical staff. Letter B, medical teams. Consultant physicians, surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of senior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. See Unit 8. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor clerk's team takes their medical history, see units 47, 49, and examiners them. Sometimes later, the registrar also sees the patients and may order investigation or test. For example, X-ray or an ECG, make a provisional diagnosis and begin treatment. The consultant usually sees to new admissions, people who have recently been admitted to the ward. For the first time on one of the regular ward runs, when the management of the patient is discussed with the registrar. Consultants also decide when a patient is ready. The patient is discussed ready to the excuse me. A patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patient in the consultant's care. Chief. Junior doctors now normally work in chief, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. to next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Available to return to the hospital if necessary from 5 p.m. to 9 a.m. The next day, days on call are set all in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trained to contract term. Exercise 6.1. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Associate. Specialist. House officer. On call. Provisional diagnosis. Radio pager. Ward round. Exercise 6.2. Match the descriptions 1 to 5 with the job title. A to E. Look at A and B opposite to help you. 1. Dr. Brahan has been a pediatrician for 8 years and is responsible for training the children admitted to Ward 60. And letter C, consultant. 2. Dr. Stewart has just started the second year of her foundation program. 2 letter D, HO, senior horse officer. Number 3, Dr. Sin has started his training as a surgeon. 2 letter A, specialist registrar. Number 4, Dr. Phillips has just graduated and is working in a large hospital in Birmingham. 2 letter E, PRHO, pre-registered house officer or house officer. Number 5, Dr. Miller is in charge of the medical staff in the Birmingham Hospital. 2 letter B, medical director. Exercise 6.3. Are the following statements true or false? Find reason for your answer in A, B, and C opposite. 1. America graduate becomes registered 2 years after graduation. False. 2. The system of training doctors in Britain is called the Foundation Program. True. 3. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patient. False. When working in shift, all doctors take turn to be on call. False. Exercise 6.4. Complete the next test of a PRHO describing her hub. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift. to find out if there have been any new admissions. Then I generally see the change nurse. He tells me if there is anything that needs to be done. Urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday, on Tuesday and Friday morning, the consultant does he worked from, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like reading up request form for blood test and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be going home. And think, of course, there are the lectures and tutorial in the training foundation program on Monday and Tuesday. Thank you.